Hello, everyone, and welcome to another 3-minute therapy session with me, Allie Bailey. And today we're going to be going over my preferred method for when working with clients. Can you guys guess what it is? That's not it. Maybe it was. I want to know in the comments section exactly which therapy method you think that I use when I work with my clients. But no, CBT, or cognitive behavioral therapy, is my preferred method. I love CBT, and I'm going to explain a little bit why. CBT focuses on the present. Sometimes we go back a little bit just to kind of explore a little bit about how we've, tailored different situations or walked through certain situations previously in our life. But really, this is a form of talk therapy that helps to kind of manage problems by changing negative thought processes. So you're probably wondering, how does a therapist that uses CBT identify exactly what's going on? Well, sometimes when we're having negative thought processes, we might have some unwanted or unhelpful behaviors, right? So for example, like if we're feeling really sad in the present moment, maybe we're not waking up until 1 or 2 in the afternoon, which can really put a dent in your day if you like to exercise, if you like to study, if you have work that you're trying to do, but maybe you have family, maybe you have other obligations and commitments, right? So especially when managing your mental health, it's extremely important to, learn the different therapy techniques that are out there. And you can also ask your therapist as you begin to work with them as well. But in this 3-minute therapy segment, I wanted to kind of go over about how our thoughts, feelings, and actions are certainly absolutely interconnected, and CBT really helps to work on the principle and teach you a little bit more about how to help yourself in those moments. So with cognitive behavioral therapy, amongst all other therapy methods that your therapist can work with you on, you can go over different coping skills, maybe identify what coping skills you currently are using as a baseline or a beginning, and then go from there and see what more you all can work with together. Therapists also use Socratic questioning, where they unwind a little bit more about what you've done in the past, so that way you can learn a little bit more about how to help yourself in the future. And us therapists always meet our clients where we are at, so if you ever feel like, well, I'm just not sure if CBT is the right method for me, or if you're looking to learn more about it, you can always shoot us a message here. If you have questions about CBT by any means, you can also go and type in the comments section, but we're here for you. And if you're already working with a therapist, don't hesitate to reach out to them.